Do you suffer from PMS? If you are saying, absolutely, raising my hand, you are not alone. 85% of women have something, like you're emotional, you're bloated, you don't feel that great during that time of the month. Dr. Petersen is here from Holtorf Medical Group. Why does this happen to us, Dr. Petersen?
Estrogen dominance and deficiency in progesterone. Women have this struggle of having to, every month, get ready to make a baby. And what it requires is high estrogen and low progesterone, and then they flip. And when they flip again, you feel bad, because when progesterone goes down, progesterone is a protective molecule in your body that protects all the tissues from deteriorating too quickly. Your brain, your muscles, your skin, everything. And when that progesterone drops to allow you to have a period and make a new uterine lining, you can have all sorts of symptoms that are hard to tolerate, whether it's cramping or bloating or headaches or depression, moodiness. It's just all sorts of things. Water retention.
Well, I'm sitting here going, okay, I got to ask this and this and this. How do you know if it's PMS or something else?
Mostly if it happens in a cycle. Does it happen every single month? Then
And does it have to happen the week of, or is it before, is it after?
It can be both. Generally, it's just before your period. But for many women, it persists the entire time of their period and even after their period is over.
That's
wrong. Yeah,
that's
a lot
right.
of your life.
Well, I like you to look in the camera and say that's not in our minds. It's actually happening.
No, it's not in your mind. And your husband needs to know that more than you do. You know it's real.
You know, and
your husband needs to know it's
I
real.
wanted to ask a question, Dr. Petersen, about your husband or whoever lives with you. What are some things that they can do to help? I mean, obviously, this is nothing that the woman is doing on her own. So
Be quiet.
Like, what can you do to help that situation?
It's my number one.
I think you're right. Anisha's right. Be quiet. Be supportive. Realize that this is not you that is doing this. This is your body. A lot of times we take like personal responsibility for when our emotions are a certain way. We're like, oh, I shouldn't feel this way. We don't feel that way about our blood pressure. It shouldn't be this high. What am I doing wrong, right? Mm-hmm. The other thing is, part of being supportive is understanding what's going on. And if you say, well, this is hard for you, what can I do to help? Well, what you can do to help is find out what's causing it and then fix it. I have a neighbor across the street, and his wife, oh my word, has lots of problems with this. And he's been great as far as saying, oh yeah, this is helping. Whatever that is, you need to keep taking it, honey, because you feel better.
So why is it worse some months and then maybe not the next month? And why worse with age?
Well, why worse with age is much easier to answer.
Okay.
Our hormone levels decline over time, and then the low progesterone is more obviously low. It's not more low relative to the estrogen, but it's just lower than really ever feels good for anybody. Why it fluctuates with time really has more to do with, did you ovulate or did you not ovulate? If you really made an egg, or if you just tried to make an egg but failed.
How does all this happen and work when you're going into menopause? What's happening
It's worse.
with PMS?
It's going to get worse with menopause. Now the trick is knowing, is it menopause because is it always there, or is it PMS on top of menopause?
That's too much. Make it go away. How do you make this go away?
Well, you test people's hormone levels. You know, one of the problems is the way we traditionally make it go away is put you on oral contraceptive pills, which will help the symptoms, but it actually makes the problem worse over time because now you quit making progesterone. You've got a progestin, which is a synthetic hormone that looks similar to progesterone, so you quit making it. Your risk of cancer goes up over time. More than 5 years on a birth control pill and your risk of cancer went up. Your symptoms were a little better, and so you say, I can't quit that. But what you needed all along was progesterone.
I think so many of us put up with it because we say this is just what it means to be a girl. This is just what happens. So how do you know when, no, it's not? It's actually worse than just being a girl.
Yeah, no, if it's really altering your life and you say there are things that I would like to do, but I simply cannot do them, I can't get out of bed for the next 3 days, well, that's probably worth looking into. If it lasts much longer than what you think is typical, you're talking to your sisters or your mom, and maybe they're not the best because they tend to have the same cycle you do, but you say, well, it's 10 days. Well, that's not normal. I'm not sure that any of us should tolerate normal if normal is really incapacitating. But a very long PMS is probably worth treating.
Are there things, doctor, in our diet or ways of living that can help with this?
Well, there are certain foods that raise estrogen, and that would be counterproductive with PMS. Soy products, for instance. Xenoestrogens are found in plastics and, processed foods like our meats and stuff. But I don't know
like
that
exercise, is that
exercise is great. Avoiding salt helps because you don't bloat as much.
I eat the fridge, like the entire.
Yeah, people tend to
fridge.
crave a lot of things. Making sure that you don't have yeast is really helpful because yeast causes more stress, and then your progesterone drops lower.
In trying the progesterone, what will change? Will all of the symptoms go away?
I mean, you're still going to have a period.
Right.
But yes, the drop, the dramatic drop, and then you say, I'm having a headache, or I'm bloating, or I'm moody, I just can't be around people, I can't get up, I'm exhausted, the fatigue, you know, those things should improve substantially. Will you still have a period? Yes, you're supposed to. If you didn't, that might be a problem too.
Well, I'm thinking about this. Don't just deal with this. Don't just live with this. You can actually give Dr. Petersen a call. Maybe go out there, check out, get your levels checked so he can know exactly what's going on. There's the information right there on our screen. Also, you can go to our own website. Just head over to abc4.com. Click on Good Things Utah. We will have all that information up there from Dr. Petersen and the Whole Torque Medical Group. Thanks for talking about this.
Thank you, guys.
Glenn, he's okay to talk about it. You're actually not.
That's right. No.
Just break. Just speak.
I don't have a clue.
quiet.
Don't say a word.
Hey, coming up next, we've got the winner of Les Schwab's Do the Right Thing campaign. Hear the story of a coach and team making an impression on their entire community. That's next.